واستفدنا من حضرتك كتير. المرضى دول بنشوفهم كتير مش بنعرف نعمل فيهم ايه في الحقيقه، فشكرا لسيادتك كتير على المحاضره. طبعا احنا معلش السيشن ده كبير شويه، احنا مأجلين الاسئله للاخر لان احنا معانا وان ليكتشر كانت اتأجلت من امبارح، فمعانا ضيفنا العزيز الاستاذ الدكتور مالك رشيد رئيس الجمعيه الجزائريه للسكر، هيقدم لنا محاضره عن سيف فاستنج with atherosclerotic vascular disease. اتفضل دكتور مالك.
شكرا. بسم الله الرحمن الرحيم. أولا أشكر الأخ كمال مصباح على الضيافة وكل الطاقم في الاستقبال. أنا سعيد جدا لوجودي معكم هنا. My topic it's about safe fasting during Ramadan in patients with atherosclerosis and cardiovascular disease. I have no conflict of interest for this topic. My agenda is an introduction with the risk of fasting and CVD. After that, we have the finding from a selection of studies, and finally, what do the guidelines tell us? You know that atherosclerosis, CVD, is a term that include condition such, excuse me, just plus my pointer. Voilà. Coronary artery disease, cerebrovascular disease, and peripheral arterial disease. It's leading cause of morbidity and mortality worldwide. And key risk factors include age, hypertension, diabetes, and high cholesterol levels. What are the issue or the problematic of fasting with CVD? There are many problems, and the first one is hyperglycemia and hypoglycemia, particularly in patients who are suffering from diabetes. The fasting can increase glycemia or decrease glycemia and depend of medication. The second one is the acute decompensation of heart failure or infarctus myocardial, and they can have emergency hospitalization. The third one is the change we can have with pharmacokinetic and pharmacodynamics of essential drug. You know that there is some drug we can stop during Ramadan, and they need to have this drug all the month of Ramadan. The fourth one, it's very, very important in during fasting. It is the dehydration with fasting, and you add the dehydration with diuretics. You know that everybody or all people with age and with aging and with CVD have many drugs, many drugs, and there is an interaction with all these drugs, and this is one of the problem during Ramadan. The comorbidities, it's one of the problem, because we have CVD in diabetes, with hypertension, with dyslipidemia, and other atherosclerosis condition. And finally, we have a lack of data in this problematic of CVD and fasting during Ramadan. What are the positive and negative interaction between CVD and Ramadan fasting? Fasting can improve metabolic efficiency, reduce inflammation, and sometimes even lower the risk of certain chronic disease. This is a good opportunity for better life. You can weight loss, you can have better dietary habits, and why not stop smoking? However, fasting needs to be approached carefully, especially in patients with existing health condition, include the potential for destabilizing cardiac condition, altering the effectiveness of medication, and impacting overall cardio health of patients. The salt intake, it's important during Ramadan, and diuretics, it's another problem. You know this slide, you know very well this slide. This is the consequence of hypoglycemia and severe hypoglycemia. You can have blood coagulation abnormality. You can have sympathetico-adrenaline response with rhythm abnormality. We can have dysfunction endothelial and hemodynamic changes with increased adrenaline and increase the oxygen consumption. And later, you can have increasing the very parameters of inflammation. So, the DAR EDF considered this severe hypoglycemia with scoring 5.5. It's very, very high risk for diabetes. Now, what are the findings from a selection of studies? You have some selection, like the acute cardiac events increase in Ramadan, and the conclusion of this study that during the study period, the number of cases with acute coronary syndrome was significantly lower in Ramadan than before or after Ramadan. And they conclude that Ramadan fasting does not increase acute coronary syndrome events. The second one, it's very interesting, interesting data from Al-Suwaidi, and this concluded that hospitalization with heart failure were not significantly different during the month before and during the month and after the month of Ramadan. There were no significant changes in the NIA, any and hematologic and biochemic, and nevertheless, patients with decompensation heart failure or those requiring large doses of diuretic are strongly advised not to fast, particularly when Ramadan fails during the summer. Another study, it's a study of liqa' al-rafa', and the conclusion of this study is that conclude that there is no insignificant association of Ramadan fasting on the cardiac patient and the occurrence of acute coronary syndrome. Another study conclude that we speculate that Ramadan fasting does not increase acute coronary heart disease event, and we believe that future prospective study should provide an opportunity to examine the relation of fasting to coronary events. Hypertension, it's another problem during Ramadan. And what you see this systematic review, you can see in the table at the right that there is data who demonstrate that there is significant reduce of blood pressure, of systolic blood pressure and diastolic blood pressure, but there is another studies do not demonstrate there is significant reduce. And this conclusion of this review suggests that Ramadan fasting can be safe in treat essential hypertensive patient with continuation of previous medication. Also, it can improve systolic and diastolic blood pressure. This study is not yet published. It is the DAR 2022 results. About 60,000 patients included, and diabetes with CVD, it's about 1,520 patients. The CVD with diabetic, type 2 diabetic with CVD fasted in 68%. This is an important prevalence. More complication, and they have more cardiovascular risk factors. They have a high duration of diabetes mellitus, and more hypoglycemia and more hyperglycemia. There is more attendees in emergency department and more hospitalizations. So you have to calculate an important risk factor or risk score for this patient. Look at these two figures. You have here the patient without CVD and with 3.8 risk of score. And when you have the patient diabetes with CVD, they have a high risk, and you move from 3.8 to 10.5. The risk score, it's a tool, very, very important tool, and need to calculate this during Ramadan for patient diabetes. Finally, I give you some guidelines for CVD and fasting during Ramadan. And the first one is the recommendation for management diabetes during Ramadan from Mahmoud Ibrahim. And they tell us that the patient with diabetes are at high risk and may choose not to fast. This is the condition which include patient with CVD, stroke, malignancy, renal impairment. The second recommendation from Akhtar, it's published in 2022. There are three levels of risk. You have moderate risk, high risk, and very high risk. In the moderate risk, you have all the conditions with stable hypertension, stable coronary disease, with less medication for all these conditions. And this type of patient may be able to fast and listen to medical advice. In the second one, you have the high risk of patient. This patient should not fast because they have uncontrolled hypertension or uncontrolled heart failure or some condition like that, who have more and more medication, 2 or 3 medication for their CVD. And the third one, it's the patient with very high risk. They must not to fast because they have advanced heart failure, severe pulmonary hypertension. This is another stratification from Tunisian, and you have the same that the first one. And you have 3 kind of risk: the low risk, the moderate risk, and the high risk. And with the first one, we have all patients with controlled hypertension, only single or double dose, stabilization, and stable chronic disease. This fasting can fast normally. In the moderate risk, you have hypertension with no control. We have more than 2 or 3 medication for hypertension and another condition. And the third one, when you have a patient with high risk fasting, it is not recommended to fast because we have hypertensive emergency as consequence, relapse, advances, heart failure, etc., etc. I can't give you all details because we haven't more time, but this stratification make the same thing, and you have all details from medication, diuretic, anti-hypertension, antiplatelet, anticoagulation for patient diabetic. And you have to know that we have the same condition with precedent recommendation, with interaction of medication with the meals, with fasting, with dehydration, etc., etc. And after the final slide, you have this DAR recommendation from DAR and IDF. It is recommended in diabetes that all people which with diabetes and pre-existing CVD, they are seeking to fast during Ramadan should receive a specific risk assessment and individual advice. Individuals with diabetes that have macrovascular complication such as stable or unstable CVD or stroke should remain classified as high risk. These individuals should generally be discouraged from fasting. Now, who should not fast? A fairly small group of patients with cardiac condition should be advised to not fast. Patients with acute cardiac illness, infarctus myocardial, and acute coronary syndrome. The patient with uncontrolled hypertension requiring multiple doses during the daytime, and patient with severe CHD requiring high dose of diuretic. And we don't forget that Ramadan is a good challenge to target your long lifestyle modification, like stop to smoking and intake a big dose of salt. In conclusion, it is crucial for patients with atherosclerosis, with CVD, who wish to fast, to follow specific safety guidelines. This included consulting with their healthcare provider and regular monitoring of their condition and potentially adjusting medication. Personalized advice based on the individual's health study is key. And finally, the majority of study on fasting in patients, and I think this is the first problem for the fasting during Ramadan. You haven't enough data, and data are limited for this problem. Because the Ramadan, interesting everybody since, I think, 15 years or 20 years, and it is not enough to have a big data or a multi-centric data from any people in Africa or in Muslim and in the region of Gulf, etc., etc. And the future study are needed and should also include more parameters, because the majority of parameters we are studies in this data. It's not the principal objective. It's not the first objective, the main objective. They are secondary objective. Donc you have to study all these conditions and all these parameters in another condition, which include age of patient, hypertension, diabetes, high cholesterol, why not ethnicity? And thank you for your attention.